Hello guys, welcome back to Clinically Clear, and today we'll be covering a bit of ophthalmology. So let's start with the first most basic topic, that is the anatomy of eye. Now, let's get straight to the point. Now, what is the shape of our eyeball? We say that it is, some of us say it is globular, but it is not exactly a single sphere. It appears like two spheres mashed into one another. So we give that name as oblate spheroid. The shape of our eyeball is oblate spheroid. The volume is about 6 ml, and the diameters, we have three diameters. We have the axillary diameter or the anterior-posterior diameter, we have the transverse diameter or the horizontal diameter, and we have the vertical diameter. Now the maximum is the axial diameter, which is about 24 mm. The anterior-posterior diameter is the maximum, and the least is the vertical diameter, which is about 23 mm. So the horizontal diameter is about 23.5 mm. It's just an approximation, but maximum is the axial diameter, least is the vertical diameter, and the axial diameter is about 24 mm. And where is it location? And in the cavity known as orbit. This we all know. Now, next coming to the three layers of the eyeball. Now we say that there are three tunics of the eyeball. Now what are these tunics or layers? First of all, we have the outermost fibrous tunic. This outermost fibrous tunic can be further divided into two parts, the sclera and the cornea. The posterior 5/6 is the sclera. The anterior 1/6 is the cornea. Let me give you an example. Here, within this whole, this is cornea, and outside this is sclera. So cornea is transparent and it is convex. It is refractory in nature. As you can see, it is transparent. You can see the iris behind. You can see the pupil behind. But sclera is white. It is opaque and it is covered by the conjunctival mucous membrane. So all this is sclera. So sclera is white, opaque, covered by conjunctival mucous membrane, whereas cornea is convex, transparent, and refractory in nature. And the junction between the two, this junction between the cornea and the sclera is known as limbus. You have to keep that in mind. Next, coming to the middle vascular tunic, also known as uvea. Now, many people confuse that middle vascular tunic is choroid. No, middle vascular tunic includes choroid. Choroid, so it starts anteriorly, that is the iris, then the ciliary body, and then the choroid. So that forms the middle vascular tunic, and this middle vascular tunic is also known as uvea. Next, coming to the innermost tunic, that is the neurosensory tunic. That is what helps us perceive vision, right? So that is present only posteriorly. Do we have retina 360 degrees? No, right? This inner neurosensory retina, it is only present posteriorly in the posterior segment. Now, let's look at the cross-sectional diagram of the eye, the axial cut of the eye, to understand where each structure is. As you can see, you have the cornea anteriorly, then the cornea continues as sclera, which is present throughout. So sclera, cornea. Then behind the cornea, you have the uvea. Uvea starts as the iris, then the ciliary body, then the choroid, this orange layer known as choroid. So the ciliary body can be further divided into two parts. As you can see here in blue, the pars plicata, and in white zigzag lines, pars plana. The pars plicata part of ciliary body, it gives rise to ciliary processes. The ciliary processes further gives rise to ciliary zonules, and the ciliary zonules are the ones that hold the lens. And this pars plana, which continues as choroid at a junction known as ora serrata, this pars plana has little less vascularity. But throughout the uvea, it is highly vascular. That is why uvea is the vascular tunic. The iris is vascular, the ciliary body is vascular, the choroid is vascular. Next, coming to the innermost neurosensory layer. As you can see here in purple, this retina is only present posteriorly. It starts here. Retina is not present behind the lens. Just behind the lens, you don't have retina. So retina is only present posteriorly. So this is just a cross-sectional diagram. You can see various other structures in the axial cut, but this is what important. You can learn them later as well when we come to each structure in detail. Next, coming to this is how we divide the eye into segments. Now, segment is different, chamber is different. Now, between the anterior surface of the lens and the cornea is known as anterior segment. Between the lens and the cornea is anterior segment. Between the lens and the retina is posterior segment. Understood? Now, anterior segment can be further divided into anterior chamber of anterior segment, posterior chamber of anterior segment. So between the iris and the cornea, just a second, yeah. Between the iris and the cornea is the anterior chamber of anterior segment, whereas between the lens and the iris is the posterior chamber of anterior segment. So this is about anterior segment. Then between the lens and the retina is posterior segment. Now what is each of these segments filled with? Posterior segment is filled with vitreous humor. Now vitreous humor is a gel-like substance. It is produced only once in a lifetime. Once you produce it, you can't produce further of it, and if you lose it forever. So this vitreous humor is made up of 1% hyaluronic acid, and this 1% hyaluronic acid gives it that gel-like nature. Next, coming to the anterior segment. The anterior segment, you have the anterior chamber, which is about 3 mm in diameter, and you have the posterior chamber, as I told before. Now, what does anterior segment have? Anterior segment is filled with aqueous humor. Posterior segment is filled with vitreous humor. Anterior segment is filled with aqueous humor. Now, this aqueous humor is produced at a rate of 2.5 microliter per minute by the ciliary processes or the ciliary epithelium of the ciliary body. It produces at a constant rate. Aqueous humor is being produced. Vitreous humor is produced only once in a lifetime, but aqueous humor is being constantly produced at a rate of 2.5 microliter per minute. And this aqueous humor is the one that regulates the intraocular pressure. It maintains that intraocular pressure. And this intraocular pressure is measured by tonometry. Tonometry is to measure the intraocular pressure. Then how does, now, intraocular pressure is a very tightly regulated parameter. It's only about 10 to 20 mm of Hg. So how do we constantly maintain it? The aqueous humor which is constantly being produced is also being constantly drained, and this drainage is via the canal of Schlemm. This canal of Schlemm, or the uveoscleral outflow, they say, through a trabecular meshwork, it is present at the AC angle. What is the AC angle? Or the anterior chamber angle, or the iridocorneal angle between the iris and the cornea. Between the iris and the cornea, you have an angle both superiorly, both up and both down. You have an angle, and through this it is constantly being drained. And the drainage is at a rate of 0.25 microliter per minute per mm of Hg. Now, why have I said per mm of Hg? Because the intraocular pressure is what regulates the drainage of aqueous humor. More the intraocular pressure, more the drainage. It's our own body's compensatory mechanism. It auto-regulates. Aqueous humor determines the intraocular pressure. Intraocular pressure determines the aqueous humor drainage as well. Understood? And this drainage is measured by tonography. And tonography is measuring the rate at which aqueous humor is being drained, but intraocular pressure is by tonometry. Very, very important. Next, coming to blood supply of eye. Now, blood supply of eye, very simple. Entire single eye supplied by ophthalmic artery, which is a branch of internal carotid artery. Very, very important. Ophthalmic artery, which is a branch of internal carotid artery. Now, as you can see here, this is actually internal carotid artery. It gives rise to ophthalmic artery. Now, first branch is the central retinal artery. As you can see here, this branch here, central retinal artery. The central retinal artery, it accompanies the optic nerve and it enters the eye through the optic disc. It supplies the inner 6 layers of retina. Now, retina has 10 layers. Inner 6 layers of the retina is supplied by central retinal artery, which is a branch of ophthalmic artery, which is a branch of internal carotid artery. Then, next we have the posterior ciliary artery. As you can see here, this one here, this is the posterior ciliary artery. This posterior ciliary artery then further divides into two: short posterior ciliary artery and long posterior ciliary artery. Now, short posterior ciliary artery, as you can see, it pierces the sclera close to the optic disc. So, once it pierces the sclera close to the optic disc, what do you think it supplies? It supplies the outer four layers of the retina. Inner six layers of the retina supplied by central retinal artery. Outer four layers of the retina supplied by short posterior ciliary artery, and apart from that, the choroid and the sclera supplied by the short posterior ciliary artery. Whereas the long posterior ciliary artery, it travels anteriorly, it pierces the sclera away from the optic disc. Travels anteriorly, pierces the sclera away from the optic disc, and long posterior ciliary artery. So it supplies the ciliary body and it further travels anteriorly to form something known as minor arterial circle and major arterial circle in the iris. That is, example here, if I look at the iris, see you have the major arterial circle and the minor arterial circle. So let's say this is the iris and this is the pupil. So major arterial circle is present outside. So it supplies the ciliary zone of the iris. Minor arterial circle in green color is present inside. So it supplies excuse me. So minor arterial circle is present inside. It supplies the pupillary zone of the iris. So exactly, so as I said, central retinal artery supplies the inner six layers of retina. Posterior ciliary artery divides into long PCA, short PCA. Short PCA supplies pierces the sclera close to the optic disc, and then it supplies the sclera, the choroid, the outer four layers of the retina. Whereas the long posterior ciliary artery pierces the sclera away from the optic disc. It travels anteriorly. It supplies the ciliary body, travels further anteriorly. It forms the major arterial circle and the minor arterial circle. Major arterial circle present outside supplies the ciliary zone of the iris. Minor arterial circle present inside supplies the pupillary zone of the iris. Last, coming to the muscular branches. There are 7 muscular branches. Now, out of these 7, 2 each to superior rectus, medial rectus, and inferior rectus. 2 muscular branches each, but only 1 muscular branch to lateral rectus. Apart from this, now we've talked about posterior ciliary artery. Now, these muscular branches, as you can see, you have multiple muscular branches. These muscular branches, they go anteriorly and they anastomose to form the anterior ciliary artery. Very, very important. And this anterior ciliary artery is what supplies the conjunctiva, the sclera, the iris, the ciliary body, the anterior parts of the eyeball. That is supplied by the anterior ciliary artery through the anastomosis of the 7 muscular branches. So this is about blood supply of the eye. Everything is derived from ophthalmic artery, which is a branch of internal carotid artery. Last, coming to the nerve supply. Special senses vision obviously carried by optic nerve. Sensory nerve supply like touch, etc., carried by the ophthalmic nerve, which is a branch of the trigeminal nerve. As we know, trigeminal nerve has 3 branches: ophthalmic, maxillary, mandibular. And this ophthalmic branch gives sensory supply to the eye. Motor supply to the extraocular muscles. Everything is supplied by the third cranial nerve, that is oculomotor nerve, except there are 3 exceptions. SO4, superior oblique, supplied by the fourth cranial nerve, trochlear. LR6, lateral rectus, supplied by the sixth cranial nerve, abducens. And 007. Now, this is not an extraocular muscle, but is present close to the eye. That's why I included it. Orbicularis oculi, supplied by the facial nerve. And then you also have autonomic nerve supply. As we know, sympathetic nerve supply causes pupil dilation, mydriasis by the contraction of dilator pupillae. Parasympathetic nerve supply causes meiosis, constriction of the pupil by contraction of constrictor pupillae. So that is it for anatomy of the eye. So we have nerve supply, we had blood supply, we had the 2 segments filled with what fluid, then we had the segments and the chambers, parts of the eye, the 3 tunics and the individual parts, and just a general introduction. So this is it for anatomy of eye. If you enjoyed the video, please do support the channel. Thank you for watching.